Acclimatization, various physiological readjustment and compensatory mechanisms in the body that reduce the effect of hypoxia in permanent residence at high altitude is called acclimatization at high altitudes. Acclimatization is possible by the following compensatory mechanisms. The increase in the pulmonary ventilation. In acclimatized subjects, the sensitivity of respiratory center to hypoxia increases. Therefore, even with a slight decrease of arterial PO2, pulmonary ventilation increases and alveolar PCO2 falls. This increase in the pulmonary ventilation is maintained by active regulation of pH of CSF and blood to normal levels. Decrease affinity of hemoglobin for oxygen under hypoxic conditions. When a person is exposed to hypoxia at high altitude, within hours there will be increase in the amount of 2,3 dpg. This shifts the oxygen dissociation curve to the right, releasing more oxygen from hemoglobin. There will be rise in the hemoglobin concentration. That is, erythropoietin secretion increases promptly on ascent to high altitude. Hypoxia is a powerful stimulus for erythropoietin secretion and thus activates erythropoiesis. This increase in circulating RBC triggered by erythropoietin begins 2 to 3 days and is sustained as long as the individual remains at high altitude. Changes at tissue level which to reduce the effect of hypoxia. There will be compensatory changes also occur in the tissues where there will be increase in the number of mitochondria, which are the sites of oxidative reaction. There will be increase in the cytochrome oxidase. There will be increase in the myoglobin, which facilitates the movement of oxygen in the tissues. Then there will be increased vascularity of hypoxic tissues. Hypoxia increases tissue capillary density, that is, more capillary open up. Hypoxia also causes vasodilatation, therefore more oxygen can be supplied to the tissues. There is increased diffusion capacity of lungs for oxygen. This occurs due to the increase in the number of pulmonary capillaries secondary to increase in the pulmonary artery pressure, pulmonary vasodilatation, and increased pulmonary blood flow. Mountain sickness. When a person ascends to high altitude, he suffers from mountain sickness. It starts approximately 8 to 12 hours after the arrival at the high altitude and lasts for about 4 to 8 days. It is characterized by nausea, vomiting, headache, insomnia, dyspnea, and irritability. The exact cause of mountain sickness is not known, but it appears to be associated with cerebral edema or alkalosis. When a person ascends to high altitude, the availability of oxygen in the inspired air decreases, but the amount of carbon dioxide increases. So in order to get adequate oxygen supply to the tissues, there is an increase in the rate of respiration. But consequently, as the respiration rate increases, there is more entry of carbon dioxide with inspired air. Therefore, to facilitate the removal of carbon dioxide and to permit the entry of oxygen into the tissues, the respiration becomes periodic. This is why periodic breathing is seen in unacclimatized person at high altitude.